message and help you. However, we run out of time for questions and participation. So stay with us and we will take questions at the end. So the content will go for 30 to 40 minutes, Dr. Carr?
Yeah.
And then we'll take questions after.
Depending on which rabbit holes we go down.
And we do that often. So on my Facebook Live post, I said today we're going to blow your mind with something that almost no one talks about. And I certainly know that when patients go to their annual physicals and their checkups or to their heart specialist appointments, I know for sure that this one topic is not ever raised. In fact, if it ever comes up, it's considered dangerous for the heart, not useful at all. And the other thing is that when this topic comes up, they tell you that you're going to get a heart attack if you continue.
Thank you, Natasha. And something we both of us need to stress upon is we always talk about women and hormones. But today we're also going to talk about men and hormones. So that is something I think a lot of people don't talk about men and hormones, particularly when it comes in relation to heart disease and stroke and diabetes. So Natasha, I'll let you start. Today we're going to give men a preference, I think, over women.
Well, you know what's really hysterical is that there are many men where if you mention hormones, they're quite shocked. And they immediately think of estrogen. And they immediately think that I've lost my mind. And this happens also, I mean, not just one-on-one with patients, but it also happens with public speaking, you know, when we're doing these presentations and you talk about hormones. So first of all, men have hormones too. Hormones are chemical messengers that control every function in your body, from the functions that keep you feeling awesome and amazing to those functions that keep you alive. Men and women both have the same hormones, just in different amounts for the sex hormones. So sex hormones are estrogen, progesterone, testosterone. And when we talk about hormones in general, people don't think about hormones like cortisol, thyroid hormone, insulin, and these are your life-sustaining hormones, without which you will die. So for example, cortisol, when abnormal in levels, when it's too high or too low, can seriously affect your immune system and your heart health. In fact, when we do salivary hormone testing in our functional medicine practice, one of the things we're looking at is the amount of cortisol and when it's produced. You can't tell this from a blood test, but there are certain patterns in a cortisol curve that can predict an increased risk for heart attacks and stroke, dementia, immune system dysfunction and cancer, autoimmune disease, and all of that. So we must not forget about cortisol as a life-sustaining hormone and as a predictive piece of information to assess increased risk. So on the topic of hormones, we all, men and women both, have cortisol. We all have thyroid hormone. We talked about insulin resistance when we were talking about diet and how insulin resistance is the biggest driver of cardiovascular disease on the planet today. It's not your cholesterol. It's not all of those things. It's insulin resistance at the foundation of it. And next week, we're going to be talking about something critical that affects insulin resistance that has nothing to do with diet. But on that topic of insulin resistance, you will die without insulin. This is how people get diabetes, with insulin abnormalities and not producing it. But insulin resistance is a state where your body is producing too much of insulin and it's driving cardiovascular disease. So I'm just touching on your life-sustaining hormones for men and women both. And then we're going to go to these feel good, awesome hormones that everybody thinks have to do with sex only. But, I mean, it's a topic everyone wants to know about, but no one wants to talk about, right, Dr. Carr? Even when you were doing obs and gynae, I mean, everybody wants to know about sex drive, and they know it has to do with hormones, but they're too shy to talk about it. But I will tell you that these hormones that you think have only to do with sex and sex drive have a lot to do with your heart health. So Dr. Carr, take it away.
Oh, thank you. So, Natasha, one of the most important things today I want to highlight, because you and I have been talking about women and hormones for a long time, but today, since we said we're going to give a preference to men first, is this is a connection which a lot of people are not aware of, is the relationship between testosterone and diabetes, so essentially your metabolism. And so, Natasha, so many times you and I have had these sort of, funny conversations about the moment you mention testosterone to a lot of men, what do many of them think it is all about?
Well, first of all, almost every man thinks it has to do with sex drive and sexual function and sexual performance, which it does have something to do with. But cortisol can affect sex drive, sexual function, and all of these things too. So there's no one thing that you can pinpoint as the thing to look after if you're looking for that. But, I digress. So you ask me directly, what do men think? And they think that. They also get defensive. So most of them will say, but I don't have any problems with my testosterone. I mean, sorry guys, but when you're 55 and 60, you have problems with your testosterone. Trust me, you have it. You start making less in your if you're already in your 50s and 60s, you started dropping your levels in your 30s. The very sad and unfortunate thing right now is I'm seeing an influx of men in their 30s acting like they're 55 and 65 with their testosterone deficiency symptoms. These men are going to die early if we don't help them make their bodies start making enough testosterone, or helping replete it if they cannot make it. Now, with younger men, I have an inhibition toward just randomly writing out testosterone prescriptions, because we know in your 30s, you should be able to make your own. Same for women. You should be able to make your own hormones. And yes, historically, we start to see a decline in production of these hormones from the 30s onwards. And that's when we see full-blown symptoms of these deficiencies, which will go through the symptoms, Dr. Carr. We should absolutely talk about deficiency symptoms. But like I said, sadly, things are happening younger and younger. I'm getting people in their 30s now showing up. And I think next week's webinar is going to be so key to understanding why this is happening earlier and earlier. So, some men are in denial. Some of them think it's normal. So when they're in denial, I don't think that they're deliberately saying, oh, I don't have a problem with my testosterone. But I think they think that it's normal to have less and then to have all these symptoms. Because a lot of people say, but I'm getting older, so why should I be able to have sex every day? Well, why wouldn't you want to if you could? Even if you're 80, like, why wouldn't you? I want to, I will. We're in the business of balancing hormones, right? But part and parcel of balancing hormones is to protect health and reduce disease and to improve the vitality and health span of our patients.
Thank you, Natasha. So the most important hormones for men, and this is in addition to the insulin and cortisol that Dr. Iyer has mentioned. One, everyone knows about testosterone. Now, testosterone, when it's measured in the lab, there are two different measures. One is the total testosterone and the other one is the free testosterone. So, and when you come to meet Dr. Iyer for, look at your hormones, you know that, yes, us, you know that we do a very deep dive into your lab work. And in fact, yesterday, Dr. Iyer and I came up with an assessment for cardiovascular disease. And I think our list was 45 tests long. But anyway, it includes other stuff other than blood tests. Going back to testosterone, one is the free testosterone. So the free hormone, and this is free hormone in thyroid and others as well. Free hormone is the part that is actively working at the cellular level. The hormone that is bound to other things, and I don't want to make it complex, that is not the hormone that's working all the time, but that's significant as well. So when you have a hormone test done, number one is sometimes you may find that your free testosterone levels are lower, but your total testosterone levels are again within the normal range. And as you know, the range is very big. So one is testosterone. Another important hormone is dihydrotestosterone or DHT. That can be measured as well, but I think you need to make a payment, right, Natasha, and on healthcare. So, but DHT is extremely important as well, because a lot of the things that happen in men, it sometimes you may find that the DHT levels are very high compared to the testosterone levels. But so all of that needs a practitioner who understands that thing. So all the different biochemical pathways. The other important thing is, and I know Natasha, you're going to talk about DHEA, but men make estrogens too. So if men have too much of estrogens, and it can be measured, men make progesterone as well. So if men make too much of estrogen, sometimes it may show up as man boobs, so gynecomastia. And in fact, if you are a man who's on hormone therapy and your doctor is not looking at all the different hormones and is only looking at your packed cell volume and not your testosterone and estrogen levels, you need to take another look at that, because in very advanced hormone therapy, as many of you, if you're already on hormones, you know that there are some estrogen blockers that may be given so that you don't make estrogens and get man boobs and get all those other problems.
Can we just
Yes,
take a quick
Natasha?
pause here? Okay, so just to go back to basics, men make testosterone, women make testosterone. Men have about 10 or more times more testosterone than women. Women have more estrogen in their bodies than men. However, you need both, and there are protective effects of both. So men don't want no estrogen, they just want normal levels of estrogen. When we replace, so before we even talk about replacing, let's talk about understanding what this thing is about free and total. So testosterone and estrogen and these sex steroid hormones are what we call lipophilic, meaning they prefer being in a fatty environment instead of a water environment. Your blood plasma is classically water based. So in order to the cells, and the cell membranes are fatty, to get it there and get it into the cells, we need to bind it to carrier proteins to carry it in a water-based medium to a fat-based medium where it's going to work. So when you measure what's bound and being transported, it doesn't mean it can work. That's the first thing. So just to expand on what you started about free and total, we might want to know what your total is, but we absolutely want to know what your free is. The second thing is that in functional medicine, we don't just, excuse me, look for the red flag to say that it's abnormal. The question is what's optimal for you, excuse me, and what is going to give you the best results for your health at this moment. Because and the other thing is what's optimal for one person is not optimal for the other, because every person has a unique biochemical environment and balance of different hormones. So for example, I will ask a patient, how did you feel and function when you were younger? Male and men and women both, right? And I'm assessing for what type of dominant hormone did they have, because a guy that was naturally athletic, could get up and run a mile with very little training is different from, sorry to say it, but the typical guy that you see playing video games with the man boobs you were talking about and the belly fat and all of that. And then there's everybody in between. So I have some female patients who were extreme athletes in their teens, 20s, and 30s. And I mean, climbing sheer rock faces, doing triathlons. Not every person can do these things, whether you're a man or a woman. To me, that means you're a testosterone dominant person. That means that your preference naturally runs where it's higher than what someone else might run at. So these are factors that we need to take into consideration when we're talking about that. The second thing is to expand on what I said about how your body can be encouraged to make more if you're younger versus when you're older. The process is natural decline, which is aging. And you and I don't believe in aging. We believe that we're going to stay young forever based on the fact that we know hormone balancing toward youthful levels helps us stay youthful, right? We don't want abnormally high. So Dr. Carr and I are not into juicing you up. We're not like the guys at the gym selling you your stuff so you can bulk up, beef up. Like, please don't come to us for hormone replacement therapy if you just want to be a big monster of a person at the gym. Like that's not what we do. We help bring you back to your best levels. And the younger you are, the more able we are to get your body working correctly to make what it needs as it should. But when you're much older, that's when we look at replacing it safely. And this is where Dr. Carr is talking about the conversion of testosterone to estrogen. So in the steroid hormone pathway, or it's called the steroidogenic hormone pathway, we're not at the office to show you the nice little graph, which maybe we should have had.
Maybe,
I think you can pull it up while I'm talking. There you go. So what you will notice is that all steroidogenic hormones come from a parent molecule called cholesterol. So I will ask you this: if cholesterol is completely bad for you, then why do all of your really important hormones come from it? So the question being, do you want to decimate the very source of all your hormones by bringing your cholesterol down to the lowest level possible? And no, that would be the right answer. No, I don't. And you will see this when Dr. Carr pulls it up. The second thing is, from cholesterol, there's a change of these molecules that become other things. And one of the things that cholesterol becomes is this hormone called cortisol that you cannot live without. It helps you manage your stress, your immune system, and things I've mentioned many times before. Then cholesterol goes into DHEA, for example. Cholesterol goes into, and Dr. Carr, you know your way around this one. I haven't seen this particular one before. So you can put the mouse where cholesterol becomes DHEA. So DHEA is an androgenic hormone. It's from your adrenal glands, and it balances with cortisol. Now, I can't go into the whole cortisol DHEA thing, but I will say to you that DHEA is a very common hormone we will prescribe sooner than we will prescribe other hormones, because it is that important for your adrenal health, balancing your hormones, and keeping you safe. Now let's go from cholesterol to testosterone. Where is that? So we're going to follow the cholesterol, cholesterol molecule. You can see how it becomes other things. And can you highlight the testosterone bit? I'm seeing, oh, there it is. Okay. And DHT is below that. So what you can notice,
sorry, I was looking
for no, it's fine. But one thing I want to point out here is look at these enzymes. And I apologize, everyone. I'm going to walk with my laptop because my dog's going to make me crazy with all of his howling. No, I can't fix it. He wants his bone. So sorry about that. But these enzymes we're going to be talking about next week. And notice that it's enzyme reactions that take one molecule to the other, but see how similar all of them are. I love this one because it's showing you the chemical structure. Now, not that you all need to know this as patients, but look what happens. Testosterone becomes estrogen. Now, this table is for men and women both. I want you to be very clear that we all have the same things, and that there's nothing that's unique to a man, other than the amounts, but testosterone and estrogen are directly related. And I will tell you that last week I had a patient come by. He was looking for a family doctor, and I was like, oh Lord, I'm going to leave this room. Sorry, everyone. So this gentleman in his 30s was given by his family doctor injectable testosterone that he's been on now for over 10 years. And now he's asking for a referral to a surgeon because he's got breast tissue he wants removed. He donates blood every every month because his blood count is this high. And I'm standing there with my jaw dropped thinking, who does that? Like, first of all, why would you throw testosterone to a man in his 30s and then not check a single thing and then start managing the side effects with blood draws? So the point being that you can go and buy testosterone from some person selling it. You can go to the US and Mexico and get hormones and supplement by yourself. But the important thing that Dr. Carr was trying to say here is that if you don't understand how these things change in your body and see how similar and connected they are, then you can be very unsafe with it. So I think I took too long to try and tell you that everything's connected here. It's all important. But the bottom line is that testosterone for men, when she's talking about diabetes, who knew that blood sugar levels are affected by the amount of testosterone? It's kind of like, who knew that thyroid, your TSH, has an effect on your bone? I mean, you think that thyroid just has to do with metabolism and, hair, skin, and nails and all the things that people think about, and no one really thinks that thyroid has anything to do with osteoporosis risk. And then you have, people following health coaches and I don't mean to say not real doctors. Well, I just said that. But I mean, I've had patients come to me and say, oh, my naturopath or my health coach told me I should just get some desiccated thyroid and take it until I get side effects. And then, when I get palpitations, then I should just back down. What the heck is that? How is that even safe? Right? And so people are taking testosterone from the gym, or they're ordering online their DHEA so that it can become testosterone. But DHEA can become almost anything else too. You can see it. It goes into estrone, it goes into estrogen, it can go into testosterone. Sure, that's what you're looking for. But if you don't measure, you're not going to know.
Yes.
Now, a few years ago, testosterone was not a few years ago. This was over 10 years ago when the first papers came out. No, even longer than that, right, Dr. Carr? When they started talking about glycemic control, which is blood sugar levels, and looking at the level of testosterone. And what they found was that when testosterone levels decline, men's blood sugar control gets worse, right? And they're more prone to diabetes. And when you optimize testosterone levels in men, their control of blood sugar levels improves. Now, at that time, they were looking at diabetic men, but what we see in our practice is exactly the same thing, but decades earlier. So we're seeing people with insulin resistance, which diabetes. We're seeing that their testosterones run low. Now, which one came first is beside the point. The point is your body's not working and we've got to get it back to balance. So we see it. We see that when you improve testosterone levels, your blood sugar levels become easier to control. Now, the mechanisms are so not important to you listening, but what we want you to know is that testosterone, and Dr. Carr always says the brain and the heart are connected. Your mental agility, your quickness of thinking, your functioning mentally, and your mood is affected by testosterone. So we don't just use it to get you all muscled up and be the biggest guy at the gym. We have no interest in that. We're interested in protecting your heart and your brain. And we know that testosterone has a very important role to play in that. In fact, testosterone also helps bone health, and osteoporosis is so high in men, but being missed because no one's checking this. And there's a link between the decline in testosterone. I used to always, when I do public speaking, say, you age because your hormone levels decline. Your hormone levels do not decline because you're aging. And that is a very critical concept that I think I should have started out with, right? Because we know that when they look at longevity studies, there are communities and like the Okinawans were one of the groups that were studied so well. And what they found was at 80 and 90 years old, these people are working in the rice paddies and they're climbing hills and they're looking after grandbabies and they're doing their exercises and, you know, being very fit and active. And what they found is that these people, based on their lifestyle and how their bodies were working, had youthful levels of hormones. And at that point, they were looking at DHEA. And they said that DHEA is the youth hormone, it's the longevity hormone, and all of those things. However, why did they not need to take DHEA? Why did they not need to take testosterone? Or the flip side is, why do you have declining hormone levels now in your 30s and 40s and 50s when it's possible for some people to not have declining levels when they're that old? Now, that's a topic for a different day because it has to do with the modern world and everything we've created in this lifestyle of ours, right? In the world of ours. However, that was the proof that managing hormone levels prevented aging. It doesn't mean you'll live forever, but when you're preventing aging, you're preventing the diseases of aging, which is what we're interested in, right, Dr. Carr?
Yes, essentially what we are interested in is postponing a lot of those diseases.
Thank you.
Rather than, you know, someone developing diabetes in their 40s and 50s. Now, I'm just stepping back a little bit to just give an overview of when should you suspect that you could be having a problem with your testosterone levels. I'm talking about men. One is, we have a questionnaire which is called the Q-Adam. Now, I don't like the name. It talks about aging male. Now, when do you decide it's an aging male? But anyway, some of the questions that we look at are, number one, of course, a decrease in libido. Next is, do you feel you have a lack of energy? Have you lost height? Now, Dr. Iyer, you mentioned about bone health just a little while ago. Do you feel that you have less strength or endurance? Or more importantly, for a lot of men who are very physically active, you may feel that you are not doing as well in the gym as you were doing maybe 2 years ago. Do you have a difficulty in, like, you know, maybe you are very much into sports, but you find that your performance is not as well as it was? Are your erections, less strong? Are you falling asleep after dinner? Now, that again takes us to many different areas, because that's not just testosterone only. So what my point is, those are some of the symptoms which might make you suspect. But at the same time, you do need to get your blood work done to see whether because a lot of these symptoms are not specific in the sense that you have this symptom, so you have low testosterone. It doesn't work like that. We have to see the evidence in the blood work. So the two are matched.
Test, don't guess.
Yes.
But questionnaires, just on that topic of questionnaires, it would be interesting if, our guests who registered, we could send them the toxic screen for the next one. But even this, the reason we use a lot of questionnaires is because testing for some things can be expensive. Do you know what I mean? Like when we're doing private testing for functional medicine things like cortisol curve, that costs money. It's not as much money as the benefit. I mean, the cost benefit ratio is absolutely worth it, but it's a few $100s, right? And so, do we spend $250, I think, is what a salivary cortisol curve costs? Or do we do a questionnaire to screen first and start working with you and then test? So test, don't guess. Yes, we like to see it. Testosterone is something we're going to replace, so we want to see the actual levels. But, I just want to digress because we mentioned bone a few times, and I want to connect bone and heart health, because we know that when bone is tearing down, which it does in osteoporosis, that you're releasing calcium. And that we know when you have inflammation and many other processes happening in the body, this increased free calcium that's floating around from bone breakdown can get into your heart and calcify the plaque that's there, leading to the hardening of the arteries, the plaque formation, and accelerating heart disease. So you can see again that there's no one thing. We can't look at testosterone just for how your penis is working or how your brain is working or that you lost energy, or do you know what I mean? It's like you could have low testosterone, have not too many symptoms because you've always been a lower functioning person, not very athletic or whatever, but your levels could be declining, but you could be losing bone and hardening your arteries. And that would be important for us to know. And that's why we do such extensive testing, because everything's connected. It's so beautiful to be connected. It keeps our brain active, right? We don't just have an algorithm to go, oh, this is not right, then do that and you're fine, and then come back next year. I mean, look at this gentleman now with he's got breast tissue that needs to be surgically removed because his family doctor just decided, oh, you have low testosterone. In your 30s, the first question I ask is, why do you have low testosterone? What is wrong with your body that I need to heal and put right and back to basics so that you can make your own testosterone in your 30s? I mean, giving him testosterone has taken away his fertility.
Yeah.
And he didn't know that.
Mm-hmm.
So for all of you guys who are just supplementing with testosterone, don't. You want to have babies and things. There's lots of other ways to get your body to be able to do what it's supposed to do, unless you want to be the Hulk, and then we just don't do that.
So thank you, Natasha. Few more things I just wanted to revisit. Number one is you talked about a young man being given testosterone and infertility. So that is the reason we never recommend testosterone replacement for someone who has still not completed his family or is in his 30s, because that makes the person infertile. Now there are
birth control.
Yeah. So the other thing is, obviously the most important question for us would be, if a man is in his 20s and 30s and his testosterone levels are falling, we obviously would like to know the cause. Now, yes, next week, Doctor, both of us are going to talk about some of the additional causes, but one of the major ones is, of course, your metabolism. So interestingly, Natasha, I think I was so excited when I read that paper. I think I must have sent it to you immediately. So this was a paper which came out not a long time ago. So what they found, and this is where metabolism and testosterone is so intimately related. And another area, we're going to run out of time today, is mental health challenges in men in relation to hormones. That is another big area, which is not always talked about. So when I talk about metabolism, so this interesting paper, they looked at men who had diabetes, and this was a longish follow-up, about 11 years, I think, if I remember correctly. And many of you are probably aware, we talk about remission of type 2 diabetes. So the term remission is the medical term. Most people call it reversal of diabetes, but then those are medically, it has to be correct. So what does remission mean? It means your diabetes is in the so well controlled, you're no longer considered a person with diabetes, and you're not on any medications. You have managed all that with only your lifestyle changes. Now, testosterone is not considered to be a blood glucose. Yeah, it's not a lifestyle change, number one, and it is not, by strict definition, it is not a diabetes agent. So what they found in these men is when they were given testosterone, their diabetes ranges went back to sort of like they were not considered to be to having diabetes anymore. And this is huge. It's like, because as Dr. I talked about, insulin resistance and diabetes, we know that diabetes is one of the biggest risk factors for heart disease, stroke, dementia, mood disorders, anything you name.
So I'm sorry to cut you off now that you mentioned time, but there's two things. Women and heart disease and hormones, we have to talk about estrogen. Mm-hmm. And also why doctors think that estrogen's not safe. And secondly, you mentioned mood, and we know that people with depression have an increased incidence of heart disease. So imagine that testosterone dropping can lead to increased depression, and then at the same time you're saying, when we replace testosterone, we're treating the depression, but it's like, okay, but then heart disease, what does see how it's all connected, like your heart, your brain, your mood, your bone, your, like everything.
Yes, and another very interesting paper was, a recent one, was the connection of testosterone, depression, and the gut microbiome. Now, like
Okay,
I
I'm
said,
going to stop
we
you
can
right
go
there.
down many
I'm going to
different
stop
rabbit
you
holes.
right
We will
there
stop
because
right
we
there.
have got to talk about estrogen.
Yeah.
And yes, estrogen's connected to the microbiome. So testosterone's connected to
Yeah.
the microbiome. So I think after we're done the series, we have to do another one on what is the microbiome and why do you need to know about it? Because without a healthy microbiome, taking testosterone or estrogen can be very dangerous and increase your risk for cancer even, right? And
Yes.
so that's something you need to know about. But let's talk about, because you brought up, like Dr. Carr does all of the academic research for our clinic and our protocols. And years ago, she put on our filing system this thing called the North American Menopause Society position statement. And this was many, many, many years ago, before it was even cool to talk about. This is when I had referred a patient to a gynecologist for a procedure and got this nasty letter back telling me there's no such thing as bioidentical hormones and what kind of crap it is, pardon my French, but it was such a nasty letter without the word crap in it. And I thought, what the hell do you know? Have you even read this paper? Right? But I mean, I didn't say that. I didn't bother to respond. I should have. And you know, I got another letter recently from another doctor. So I think I will just send the NAMS position statement and say, hey, you know what, this is actually current science and you should keep up with it. So doctors historically have associated estrogen with an increased risk for heart attacks and blood clots. Now, I will remind you that we specialize in something called bioidentical hormones. Bioidentical hormones are made to look like your own body's hormones. Why is this important? Because hormones work like a lock and key. The lock is the cell receptor on your cell membrane, and the key is the hormone that unlocks it and says, do the work. So if testosterone or estrogen are going to get to the cell membrane, then it makes the cell do the action that's intended. When you use a synthetic hormone, the key is not precisely fitted to the lock, which is why you can have side effects. Not that you can't have side effects to bioidentical hormones, but we're good at it, right? And we check you and we make sure that there aren't any negative side effects associated with the therapy. That being said, estrogen, when it's synthetic and when it's taken by mouth, even if it's natural and bioidentical, will increase your risk for blood clots and heart disease. This is a fact. I explain it to patients as it makes your blood more sticky. Right?
Yeah.
So what the North American Menopause Society has said in their position statement, so we didn't make this up. We just hope the cardiologists and the gynecologists are keeping up to date. But what they're very clear about is that when you use transdermal estrogen, and I'll translate that to transdermal testosterone as well, it is not inflammatory. It doesn't make your blood sticky. So the route and the type are very important. And so women and heart disease, Dr. Carr, this is your favorite topic. Women, hormones, and heart disease. Can you please explain now very quickly why estrogen is important? Estrogen replacement. I don't want to hear about the window of opportunity and all of that, but I want to know the details for our patients. Why is estrogen important to protect your heart and brain?
Okay, thank you, Natasha. So before I go into women and estrogen, I just wanted to mention it because we don't have time to cover it. Now, Natasha, you talked about testosterone as a cream or a gel on the skin. So should you use an injectable? Should you use a cream? That is for a different discussion. Each has their, the advantages.
I do both depending on the patient.
Depending on the patient and
monitoring and costs and
yes.
all of those things.
So yes, ideally we would like everyone to be on a.
I don't do injectable for women, and I've inherited quite a few female patients on injectable testosterone, which is shocking. But let's stop.
Yes. So let us stop that. But there, it is nuanced, so it needs to be differentiated. When it comes to, and Natasha, the other thing is, it's, of course, today we're talking about estrogen because we don't have enough time, but progesterone and testosterone are equally important in women. So if women have very high testosterone levels, that impacts their metabolism. We are not going there today. So estrogen, now estrogens are 3 different types: E1, E2, E3. E1 is the estrogen which is predominant after menopause, and that is the estrogen which is connected to increased risk for breast cancer and all of that. So E1 is not a hormone we ever replace with. And Natasha, back in the days, many people used to use E1 as a replacement.
We're going to answer the question, Dr. Carr.
Yeah, so the next is E2, which is the 400 different functions of estrogen. So that is the one that is the most active estrogen. E3 is predominantly the estrogen of pregnancy, but it does have a lot of benefits as well. Even
to the vagina and bladder in particular. So we need that one.
It's a very safe estrogen, but it does not have the 400 different actions of E2. So E2 is the one that is, I think there's probably no cell in the body which does not have E2. Most importantly, the heart has E2, the pancreas has E2 receptors, the brain has estrogen receptors, and the brain is also capable of making its own estrogen and progesterone and all these hormones. So
you got to wonder why God created us that way. It wasn't important.
Like I said, there is no redundancy in nature. So there has to be a reason why these were there where they are. So going back to estrogen and menopause and metabolism.
Estrogen and the heart. Why is estrogen important for the heart?
Yes. So one is, of course, there are estrogen receptors in the heart. And for women, diabetes, and in fact, there are estrogen receptors everywhere, even to maintain your blood pressure. Diabetes and blood pressure are much bigger risk factors for women when it comes to heart and brain than any of the cholesterol or anything else, and definitely more prominent in women than in men. But the most important point is, if you are not going to change your lifestyle and you feel that just slathering some estrogen hormones on your skin is going to take care of your weight and your diabetes and blood pressure and everything, I'm sorry, that is not true. But along with everything else that we do in functional medicine, because you know that we always start with food first. So heart and estrogen is extremely important. And like Dr. Iyer mentioned, estrogen taken as a pill by mouth is very different from the estrogen used and the estrogen used on the skin does not increase your clotting at all.
Right, but what about estrogen and the WHI? What did they find when they looked back on that? What did they find about estrogen and the heart attack risk?
So what they found, so the WHI study was way back when they started looking at hormone therapy, and then all those, it came out that hormone
oral estrogens and women, right? So what did they find after?
Women. So what they found afterwards was those women who were only on an estrogen, this is an oral estrogen, these were women who had a hysterectomy, so they thought that they didn't need progesterone at all. Those women did not have all these problems with,
heart disease, stroke, blood clots, and all of that.
So
and granted, estrogen by itself reduced the risk compared to estrogen and a synthetic progesterone. But if we look further, that data and what they found about women on estrogen and heart disease having a lower risk compared to the other arm, then translated into more studies being done and things being looked at differently. And what they did find is that over time, the risk for heart disease and stroke is reduced when you replace estrogen in a woman. So thinking that it's normal to get old, hot flashes, and men, like people think that estrogen's for hot flashes only. Let's just say that it's great to sleep through the night without hot flashes, as I'm finding out now. And it's not great when they keep you up all night. However, that is not the only reason we use estrogen. We don't, I've got a urologist, I sent a patient to a urologist, and he put a woman on vaginal estrogen just for the health of her bladder. And again, historically, estrogen was just used for vaginal dryness, leaky pee, all the things down there, because you think, oh, you're a woman, you have estrogen, it has only to do with your women parts. No, it has to do with your brain and your heart and your blood pressure and your overall health and your well-being. And then never mind that estrogen deficiency leads to crinkling, sagging skin, and you look older on the outside as well as you're getting older on the inside. So, personally, I will never not take estrogen, even though my mother and her sister had breast cancer.
Mm-hmm. So
And there's a reason. It
we'll
is
talk
so
about that on
important.
another day, Natasha. That is
Yes.
very
But
interesting and
that
very
being
important.
said, I will not take estrogen because I have a family history of breast cancer, because there are, oh, now we have to wait for breast cancer month to do a whole series on estrogen and breast cancer. Okay, but now,
Now
oh good
we are
Lord,
going to
we
run
are
out of time. I think we'll open
right.
it for questions.
And
So
I think
feel
this part
free to
about women and
chat.
estrogens should have been covered at the start. So we'll send out a little note saying, women, wait till the end, because we are talking about you.
Yes, Natasha, last time we had promised that we were ignoring men, so we should give them some importance.
Okay, but you know how to control all of these things. So
Yeah.
you take the
If
questions and
any
then
of you have questions, you can either raise your hand and unmute yourself, or you can type in the chat box or in the Q&A box. Any of those options are fine. And we are going to wait for a few seconds because Dr. R and I have gone through a lot of information. I know it takes a lot of time sometimes to process some of that.
okay, I see a question about no.
So one question I can see is about early menopause and hormone therapy. And so in this limited time we have is early menopause is if you have menopause before the age of 40, either naturally you just went into menopause, or as a part of you had a surgery for non-cancerous conditions. Should you be on hormone therapy? Absolutely. That is what the guidelines say, that women who have early menopause, that is a risk factor for heart disease, stroke, and dementia. So women who have had early menopause should get onto hormone therapy. Absolutely. And if your doctor has been telling you otherwise, that is not true.
And just because you had a hysterectomy doesn't mean you don't need progesterone, because
Yes.
you have a brain, you have bone, you have a heart, you have blood vessels, like those things are kind of important. So who cares if you don't have a uterus? You still need progesterone. And on that note, I will tell you that I had a patient join our practice last year, and she came in on Estrogen, which is E2 by pump. It's a pharmaceutical medicine. And she came in, interestingly, without a uterus, and her doctor amazingly put her on progesterone as well. And she came in on the pharmaceutical progesterone. And thankfully, it wasn't the synthetic one, it was the bioidentical one. And, through our process, I switched her to bioidentical, and her sleep suddenly improved more. And she started to feel better overall. And so there is a difference between bioidentical and synthetic. The dosing, you can't customize dosing of synthetic pharmaceutically made hormones. They come as a dose. The progesterone's 100 milligrams. Well, I have some patients on 112.5. I have some patients on 475 milligrams. I have some patients on 250. It's highly customized, and that's why we compound. So when this gynecologist wrote to me in all of her ignorance and said there's no such thing, it's not recommended, it's completely unsafe, blah blah blah, well, the thing about compounded hormones is that you have to use the right pharmacy with the right background, with the right experience, with the right testing, and not all compounds are created equal. But the beautiful thing about compounding bioidentical hormones is every person's uniqueness is taken care of, and the dosing is created for them. You always want to use the most minimal dose of hormones to get the results. You should never take extra, because one, there's no need, and two, you're increasing your risk for adverse side effects, including increasing your risk for cancer and other things, right? Which is the thing that most people are concerned about. So more is not better, not for testosterone, not for estrogen, not for any of these things. And it's amazing how, like even the thyroid, just keep taking it until you get side effects and then back down. Like, no, this is a scientific process. This is very carefully managed in replacing hormones. But what we wanted you to get is that they're so critical that even medicine, which is about 20 years behind functional medicine, is starting to catch up and say, replace hormones early, look after women better, use topical transdermal means through the skin, right? And we're going to talk about the skin next week, by the way, right, Dr. Carr?
Mm-hmm.
And
Yes.
then there's a question here about, why we were talking about men so much. One, we wanted this to be for all of you, not just some of you. And second, all of you women have men in your lives, and men are the worst to come in. 90% of the men, no, I shouldn't say that. In the past, 90% of the men that came into my clinic, which were 30% of the practice, were actually brought in by their wives or sent by their wives, right? Today, though, I will tell you, we have an influx of men coming in looking for healthy aging, knowing that they don't feel quite well and they're too young to be losing it. They're searching for healthy aging and longevity. They're so much more aware of this. But talking about men and women and why we're saying this is because everybody needs to know this information. Did you know that taking hormone replacement therapy, even if you don't have hot flashes, you have a great sex drive, you don't leak pee, you don't have to wake up at night to go pee, everything down there is all healthy? I mean, hallelujah for you, but you still have a brain. And just recently, I've had 3 lawyers, it is just because I bring it up, like, since I need estrogen now, I'm thinking, oh my God, I was so relating to what you used to tell me about estrogen, like you can't skip your dose if you've got a presentation to do, or you really need your brain. And I'm finding the same thing, because when I started dropping my estrogen levels, I didn't notice because I didn't have all of those other symptoms, but I honestly felt like I was losing my brain. I could read something and not retain like I used to. And I have a pretty incredible brain for retention of certain things. Not everything. My children will tell you, my dad will tell you, I have a really bad memory for remembering to send him this or bring him that, or, I'll go to his house without something I was supposed to take. But if I read something, I know what I read. And I can tell you, like, years later, I can still recall my embryology lecture from second year med school, which was in 1991, right? So like, I remember things, but now I'm really not retaining information. I'm having to read things again. I felt like my brain was being taken away from me, basically. And then I started estrogen. I was like, oh my God, look at the difference. And then I was like, oh, look at my skin, look at the difference, right? So I like them both. But just, we wanted you all to know about hormones and estrogen. And the final thing, though, is when you're using topical hormones, you can transmit that to your partner. So if I'm giving you a testosterone cream, and you're holding your wife at night and it's still on your hands, I've seen women have high testosterone levels, like sky high, through the roof, on their salivary testing. And I'm thinking, where the heck are you getting this from?
It can come even from handling laundry.
Yeah, so there's a lot of ways. So you have to be careful. And that's why we're saying to you, you need this information. You can't go to some person who read one article or some guy in the gym offering you testosterone and just take it because it felt like a good idea at the time. It needs to be monitored and managed carefully, but the benefits are incredible. Estrogen can make its way into you from makeup. In the US, they're not as carefully regulated as Canada. And I've heard of lipsticks and some body care products containing estrogens. If you have a family history of cancer, if you're a poor methylator, if you have some of these other things we're going to be talking about next week, you don't want estrogens making itself into your body without you knowing what it is and how much of it and how it's being handled by your body. So just remember that everything is not as simple as it seems. It's not as easy as popping a pill. It's not as simple as just getting a prescription. These things can all have negative impacts, but the positive benefits are quite amazing. So I would highly recommend you explore hormone replacement therapy if you're in your 40s and 50s or beyond, because the differences can be incredible. And on that note, protect your heart, protect your brain, protect your health span with lifestyle changes and functional medicine.
Thank you. Thank you, everybody, for investing your time with us, and see you all next week. Bye now.